questions, numbers will be on your screen.
This is a great time here to get things planted up. You know, the average results.
A lot about treatment.
Oh, please join us. There's a question. Hi there, I'm Shelley Irwin. Thanks, of course, for joining us for Ask the. Tonight we're giving you a healthy dose of advice as we talk to doctors, medical specialists. Feel free to call in, of course, with your questions. Free advice. Numbers will be at the bottom of the screen. Joining us tonight are such Dr. Joe Cranen. Dr. Cranen, appreciate you. Dr. David Lowry, glad you are here. You've brought your invention in. And Dr. Patrick Brunden, thank you for joining us on behalf of Van Andel Institute Research. Dr. Lowry, please.
2 days a week, I spend my time seeing patients at the Brain and Spine Center in Holland. As a neurosurgeon, I deal with conditions of the nervous system, brain, spine, spinal cord, that require surgical attention. I do surgery 2 to 3 days a week, and then about a half day to 1 day a week I spend on some medical device development work.
Dr. Lowry, I've heard the saying 8 out of 10 of us will have back pain in our lives. How true is that? And let's talk on the status of back pain these days.
Yeah, that is true. Back pain is one of the most common reasons for a person presenting to a physician. And of course, from an economic standpoint, it's a very common reason for a person to be unable to complete their tasks at work. And so not only is it an important health problem, but it's an important economic problem as well. Related to that are problems in the neck or neck pain. And, you know, of course, one problem that you and I have had a chance to converse about previously relates to herniated discs in the neck or bone spurs occurring in the neck, which can cause impingement of a nerve leaving the neck and serving the arm or hand. And you know, also, as we've discussed in the past, there's some new ways we have of addressing those problems when treatments short of surgery aren't enough and the symptoms persist.
Dr. Lowry, can you introduce us to your latest invention, for lack of a better term?
Certainly. When people have a herniated disc or a bone spur in the neck, conventional treatments that we will frequently resort to surgically, if other treatments are not working, are either a fusion or a linking together of two bones in the neck, or an arthroplasty, an artificial disc of the neck. These are great treatments in that they're highly effective when we do have to go to surgery, but the downside of these treatments are that the time off work for people averages around 50 days and you know, 4 to 8 weeks depending upon what study we look at. And so one of the treatments that I'm quite excited about is one that I've been privileged to be involved in developing, and that is a TransCorporeal MicroDiscectomy, or a procedure in which, rather than removing an entire disc or cartilage pad between two bones, we simply drill a channel through one bone, remove the herniated disc fragment or bone spur compressing a nerve, and then following that, place a little plug in this position filled with a patient's own bone, and the plug then gradually over time is reabsorbed as a patient lays down new bone. The primary benefit of this treatment is that a person retains their own native disc tissue, they retain natural motion across that disc, and because we're not placing an implant between two bones which sort of grind together a bit, which can be painful, patients can get back to work much more quickly. So with a fusion, the mean return to work time, or the average return to work time, is about 50 days or longer. And with this procedure, we're finding that that half of the patients are back to work within 4 days.
Because the age group, I trust, is such that active individuals need to continue their life.
Exactly.
Yes.
Or working individuals need to continue their work. Of course, time off work can be very expensive, especially for someone who's self-employed. And so, you know, it's great for the right patient.
Dr. Lowry, exercise, either pre or post surgery, pre or post back pain. What's the latest with this as a helper or a hinderer?
Definitely a helper. When a person has what many people will refer to as a back attack, or if their back goes out, often what they're actually experiencing is pain that's originating in the muscles. That's the most common cause. And especially a person who's having muscle spasms, sudden tight gripping pains where the muscles have severe contractions that are difficult to control, those individuals actually do better and recover more quickly with movement rather than just going to bed for a few days. So if people experience that, in general, I would recommend using application of heat in a warm shower. I always tell people, if you're applying heat to the low back, always check the temperature of the hot water bottle or the electric blanket with your hand. Don't trust your skin to tell you if it's too hot, not the skin of your back. Check it with your hand. Your hand will be much more effective at detecting whether it's too warm. But application of heat and activity with gentle stretching would be better than immobilizing yourself in that situation.
Great. Dr. Lowry, a question was brought up regarding smoking. How we know smoking's probably not the choice to have, but doesn't it delay healing? Isn't there a correlation where where does that come into play if I'm a smoker and I'm your patient?
Yes, absolutely. Smoking has a negative impact on bone healing in particular. And so when we have patients who require a spinal fusion, we strongly advise that they discontinue smoking in advance and also for at least 3 months following the surgery. If we could talk all of our patients into discontinuing smoking, we certainly would. That, of course, is only one of the many things that it can cause in the body, including negative impacts on the cardiovascular system and the pulmonary system. But the bones are certainly affected as well. So just one more reason not to do it or to stop if one does.
Appreciate what you all three do, and of course stay focused on your craft for we, the lay public. Thank you, thank you, thank you. And as always, thank you for your calls. Great questions. Do stay healthy. Take care.